My name is Dr. Ndovie. I'm a specialist obstetrician and gynecologist working in Namibia. I'm a Merck Alumni who received training in Merck Fertility and embryology training program. So currently we don't have specific data in terms of the prevalence of infertility in Namibia, but we do know that at least 1 in 10 couples are affected with infertility. And currently we still have a shortage of specialists because there are 2 of us that have been trained through the Merck Foundation program currently, and there are other resident specialists, 3 of them in Windhoek. So Merck Fertility and embryology training program has improved my clinical skills in terms of assessment of patients. It has improved my clinical skills as well in terms of how to counsel patients and also providing the necessary treatment for infertile couples. In terms of the country itself, it's actually helped us now to bring the services closer to the community, because I work in the northern part of Namibia. So before, most of the infertility couples that require IVF services, for example, they had to travel long distances. The country is quite vast, and towns are very far apart. Like where I'm working to the nearest IVF center, it's about close to 700 kilometers. So for most of the patients have to travel that long distances to go and find a fertility specialist who can properly do an evaluation and even probably provide them with alternative treatment. So at the moment, at least it allows patients to get access to specialized patient assessment. We're still yet to start providing IVF, but at least we can stratify patients properly now, and those that require IVF are properly referred to the nearest centers. So far, I've learned quite a lot in terms of how to approach a couple that is infertile. So we've learned the basics in terms of counseling. We've learned the basics when it comes to even history taking. It has allowed us now to actually request important and relevant investigations. Clinical skills have actually improved significantly because I'm able now to do laparoscopic procedures as well as part of the treatment and investigations. And again, it has allowed us also to start patients on simple treatment options that we can give them before they're referred for IVF. So where I'm working at the moment, we're working closely also with the Ministry of Health to try and improve, to try and see how best we can improve the service in our area. We have a regional hospital there where patients also being managed in the public sector, and we want to have that partnership between the public and the private so that we can improve the service provision. So for some of the success stories, I don't have the specific numbers, but I'm still seeing quite a few of my patients being successful, getting a successful pregnancy, and also able to actually delivering a live birth at the end of it. And some of them, I think, in terms of the assessment of the patients themselves, they're quite happy with the assessment that is being done and the knowledge that we're trying to give them in terms of infertility. For very difficult cases where they need referral to an IVF center. We're really trying our best to make sure that we've done proper assessment and collaborate with the nearest IVF center. The Merck Fertility and Embryology training program, it's a very good program that I would really recommend that most of the specialists or clinicians should be involved in, because it does help us quite a lot in terms of infertility management, which has been a challenge for most of the regions in Africa and Southern Africa in particular. So we need more clinicians to be trained, and I would really recommend that they take part in the Merck Fertility and Embryology training program. I would really like to thank Merck Foundation for the opportunity that they gave me to go for the training, and I'm so grateful. At the moment, I promise that I will do my best to bring a positive impact to the community where I'm working at the moment.